calcaneal fracture dislocations, kind of a variant pattern that you may have seen, or maybe not, but it has probably seen you perhaps. So no disclosures relevant to this. And so J.B. Carr kind of defined the pathoanatomy of displaced interarticular calcaneus fractures back in 1989 and identified two main fracture lines, vertical and horizontal, that typically create four different fragments extraarticularly. And depending on the direction of the force, if the force is carried more posterior, that will produce the joint depression type, versus if the force is directed more axially, that produces the tongue type or split tongue variant. So in 1977, there was a case series of 4 cases described in which of those two fracture lines, it was exclusively in the sagittal plane. So they defined that there was an anteromedial and a posterolateral fragment. And so oftentimes they observed that this posterolateral fragment was dislocated beneath the lateral malleolus. And so the pathoanatomy with this particular variant pattern, vertical fracture line only, and the superolateral joint fragment that's normally separated, in this instance remains attached to the tuberosity, and the anterior main fragment remains attached to the constant or sustentacular fragment. This fragment is then driven into the talofibular joint, and it will lock the subtalar joint. You will often see in this instance, if the lateral ligaments are blown, this varus tilt of the talus, and so it's frequently misdiagnosed as an ankle sprain in the emergency room. And if you look closely, there you can see that asymmetry right there.